Welcome to the State of Health. I'm your host, Karen Bowling, Cabinet Secretary for the West Virginia Department of Health and Human Resources. We are on location here at the Charleston Civic Center for the 2015 West Virginia Integrated Behavioral Health Conference. This three-day conference is addressing some of the most pressing issues facing West Virginia and the country today. The skyrocketing rates of substance abuse and overdose deaths. Participants are also tackling the mounting struggles with behavioral and mental health, issues that have been connected to mass shootings of school children, moviegoers, church worshipers, and family members. More than 600 medical professionals, substance abuse prevention specialists, educators, family and survivors from around the state and country are engaging with international and national experts and addressing the issues on multiple levels. The National Substance Abuse and Mental Health Service Administration, also known as SAMSHA, which is under the United States Department of Health and Human Services, is a key supporter of this conference. Joining me is Joan Gillece, Director of SAMSHA's National Center for Trauma-Informed Care. Welcome, Dr. Gillece. So happy to have you here.
Thank you. It's great to be here in West Virginia.
Obviously, you're our keynote speaker. We were so excited to hear your message today. Could you share a little bit about a trauma-informed system of care and why that's so important today for all of the individuals who are here at our conference to understand and to be able to really go back into their communities and implement?
Sure. Well, the prevalence of trauma is widespread, and it goes throughout systems, whether in mental health, substance use, juvenile justice, adult justice, foster care. We're really addressing that impact of witnessing of violence or of early physical, sexual abuse, abandonment, neglect. And so what's important when we implement trauma-informed care is to start addressing not just the behaviors that we see, but addressing the causes of the behaviors and helping those that we serve connect those dots and think it's not just what's wrong with me, but what happened to me.
You know, I was very moved by the stories, the different types of ways in which people are trying to think differently about trauma and its impact on people in society. Can you share a few of those stories with us, things that you've seen, that you've learned, that really are not necessarily clinical, but are really things that we think about in terms of how we treat each other?
Sure, and it really is a cultural shift, and you know, our motto is you don't have to be a therapist to be therapeutic, because we're really looking at everyone has a role to play, and sometimes this just boils down to how we treat one another. So one of the stories that I saw that was most incredible happened in a criminal justice setting. It happened in a prison in Hawaii under the leadership of Mark Patterson, who was the warden of the women's prison, when he understood that many of the women ended up in the criminal justice system for what they did in order to cope with what happened to them. Many were in there for substance use, prostitution, issues that really had at that basis, that core basis, unresolved early trauma. He changed his whole culture. So when women come into that facility, they're greeted with, you know, you have to do your time. We're not excusing behavior, but while you're here, we're going to help you heal and we forgive you. So the women are growing organic vegetables to feed the community. In other programs, correctional officers, mental health workers understand the meaning in that behavior, and they start to develop systems that are more strength-based versus deficit-based. So we're trying to build back people who were wounded, and most of the people in many of these systems that we provide support to folks are in pain.
And just to sort of elaborate on that, we talked a little bit earlier about the fact that they are in pain. And when people are in pain, then they're going to do something to try to reduce that pain.
Right.
And that leads to things that we're talking about here today, the substance use disorders, all of the things that we know are big problems in West Virginia, but also problems across the entire country. And when we talk about dealing with pain, can you connect those dots a little bit more for us in terms of how does pain then sort of translate into trauma and our trauma-informed system of care, and how we need to make sure that our providers and the people that are interacting with individuals in our system understand how to relate differently to the people that we serve?
Sure, and I think when we use the concept of healing, it resonates differently, because healing really just connotes that the people that we're serving have have pain. So we're looking not just at that behavior, we're looking at going deeper and understanding where the behavior came from. And oftentimes, it's difficult for people to express it because oftentimes people don't realize what happened to them was trauma. Oftentimes, if you had the trauma pre-verbal, you don't have the words for it. Oftentimes, if you were dissociative or took yourself out of the situation when the trauma was occurring, you don't have the words for it. So it's really just, I think, thinking differently about where these behaviors are coming from versus just getting at that behavior. And I think when we dig down even deeper, we're going to see that there's some huge pain underneath all of this. So healing is, I think, the message that we should be putting forth.
I think all of us have a role in healing, no matter what we do in any of our settings where we're helping, our youth, or we're working in the adult system of care. We can all create an environment that's healing.
Right.
So what are some ideas, some ways that we can create better environments for individuals who are incarcerated or people that are going into, psychiatric residential treatment? What is it that we need to think about in a different way when we are talking to those individuals, and really visually what they see when they come into our settings?
Well, I think it can happen anywhere. I think that first point of entry, the receptionist. I mean, you know, in your own life, how you go into places and receptionists can either make or break your day. Right. Think about going to Motor Vehicles Administration or wherever you might be. That first point of entry is really important. Are you greeted with respect and courtesy, or are you told, here, fill out these papers? What do we do in our waiting rooms, for example? If it's a child serving program, do we have toys that aren't broken? And do we have maybe a snack for kids that are coming in and maybe hungry after school? What do we do in terms of our criminal justice system? How can we look at the reduction of shaming individuals? Clearly, people are not going to be excused for whatever behavior they might have gotten them into trouble in the first place, but to look really seriously at where that behavior came from, and to create environments that are comforting rather than controlling. Not to coddle behavior, not to excuse behavior, but to reduce the likelihood of violence, to reduce the likelihood of contention by creating environments that are that feel soothing and calming.
You know, I have a particular interest in children and in youth, and how do we help these children so that we do have a really good trauma-informed system of care, and that we're ensuring these children get the most appropriate care, right time, right place, by the right provider. And I love your story about what happened in the facility where, you had an issue and the warden wanted to decrease, acting out behaviors, the girls, and looked at things differently. And I think that's a great example. Could you share that with us?
Yeah, it was a wonderful program in Florida, and the warden came to a trauma conference. She got it. She said, no wonder these girls are banging on their doors at night. A lot of them have been the victims of abandonment, victims of abuse. Things happened at night. I get it now. Before, I used to think they were attention-seeking, manipulative, oppositional, defiant. Now I understand they're young girls that are scared. So she had a correctional officer who was an artist paint every cell with beautiful scenes to reduce that likelihood of that stark environment that's causing these girls to be so upset and unsoothed. She then, one of my favorite things she did is she bought them long flannel nightgowns, because it's very different to be a child in that long flannel nightgown than to be in your gym shorts and t-shirts. So she changed that whole culture. This all might seem ridiculous and not very scientific, but it's important, and she soothed and comforted rather than controlled. So she changed the whole way the girls saw themselves. She changed the way the officers saw themselves, just through implementing these very, very simple things that she created. No one told her how to do this, but it's that really those creative things. Looking at programs where one program we were in, the kids, it was a residential facility, and the kids between 3 and 5 were really upset, agitated. It's when they had the most incidents occurred. They switched that time, 3 to 5, into what they called hors d'oeuvre hour. And so they started serving hors d'oeuvres between. So they took a time that was really difficult and turned it into a time that the kids looked forward to. So by hors d'oeuvres, they did celery sticks and carrot sticks and some little different dips. And, you know, had those kids sit and have their hors d'oeuvres before their dinner. She eliminated all of those issues that were occurring during that bewitching hour, you know, of 3 to 5, just by coming up with some creative solutions that aren't clinical.
You know, I love that approach. I mean, I think it makes sense for, you know, those of us who've been involved, you know, in providing services to children and adults, that it's relationships matter.
Yeah.
And you said that more than one time. Relationships matter, and individualizing relationship and understanding the why.
Yeah.
Of the acting out behaviors rather than just treating the behavior. I mean, I know there's so many courageous survivors out there that tell their stories. Do you think that really does make a difference in terms of understanding when people can speak from their heart to others, when we're trying to sort of change a culture of people who have been providing care in a certain way for so long, and we want to make it different. We want to do it differently.
Sure, and I think you're going to hear from William Killebrew. He'll be speaking in just a moment, and the, you know, William's story of hope and resiliency in the face of extreme pain really resonates with individuals. So, yeah, I think that in addition to people just telling their own story, I think it's important for people who have received services to tell us what would make a difference and what can we do differently. So it's not just telling your story. It's about people listening, understanding, and being advised by people receiving services about what can we do differently to create those environments. So it needs to be a partnership, in my opinion, of people who have been the recipients of services as well as people who have been the providers of services.
Well, thank you so much. I really enjoyed meeting you, and certainly hope to see you again back in West Virginia as we continue to learn and grow.
We'll be back, and thank you so much for having us.
Thank you. Coming up, we'll meet a man whose story has been featured on Oprah, MSNBC, CNN, BCC Worldwide, and many more media outlets. And he is speaking at this conference. We're so excited to have him. We'll tell you why when we come back.